personally, I've listed a few, but the main one for me was the alignment with my PhD, because I'll be looking at antimicrobial resistance or antimicrobial stewardship within community pharmacies, and this really aligned with that.
For me in the NHS, I think was actually quite huge and quite amazing. In particular, when we came back from Ghana in June 2019, we immediately set out to change how we run our PPS within my hospital. I know that personally, I think more about how AMS impact, how my actions impact on antimicrobial resistance. But more than that, we learned about lots of resources that we've used quite frequently throughout the year, in particular the behavioral psychology sessions, as we've worked really hard to improve on our medicines management policies within our hospital. I found that the training that we had throughout those sessions has been extremely useful.
All in all, this fellowship was a really, really amazing experience for me. I gained valuable insight on AMS at global level and a greater understanding of the shared vision of AMS globally. And as a community pharmacist, it made me realise there's a lot more that we can do to help educate, especially on a patient level. And I feel extremely lucky to have this experience.
What can I say? It has been an absolute roller coaster. I feel like my contribution and impact to the project was vastly increased due to the fellowship. It had such a positive impact on me. I can genuinely say that it's completely changed how I see the world. It wasn't without challenges, but these were definitely balanced by the overall pride I have now in what we've managed to achieve in the time we had. And the biggest thing for me is the people that I've met, both the chance to work with my amazing colleagues in Ghana, but also the opportunity to work with a fantastic group of my new phone a friend options, if you will. I'm blown away by the impact that my fellows have had, and I hope to continue to work with them in the future.
In terms of the Global Health Fellowship benefits, I would say, to me, just to echo everything that Fran said, it's been quite an amazing experience undertaking the fellowship. And I think not only increase in development of leadership skills, but also a much greater understanding of the need for and the difference that an antimicrobial stewardship programme can make to a low middle income country such as Ghana.
So for me, just to reflect what everyone else has said, the fellowship has been so impactful for me personally and for my career. It's hard to imagine that it's just a year since we started because so much has changed. I've taken on projects back at within Northumbria around antimicrobial prescribing. I've taken the lead on them. I've progressed my own career. I've talked about this to anyone who will listen, and it's really had such a positive impact on me and my career. So a big thank you to CPA for the opportunity.
And to summarise really what the fellowship has meant for me, it's been wonderful to see how all the amazing work that's been done here, but also to be able to build on the collaborations that we were able to develop through this fellowship, and to also evaluate my own learning and leadership skills, and try to connect people across the CPA with colleagues, pharmacy colleagues in India and South Africa and Uganda and wider. So that's something I want to build on now with through this professorship that I have with India, UK, but also to bring that into the CPA.
What's meant to me really has been echoed by all my colleagues. It's really been about the networking and the feeling of self-worth and helping out other people. Also, I completed an MSc in global health, and so it was amazing to be able to put this actual course into practice. What I think has been really good for the NHS specifically at this time is actually our Zambian colleagues were able to teach us in BSUH how to produce hand rub, and that's been done by the University of Sussex. So that's been an excellent thing that's happened.
So what has the fellowship meant to me? It's pushed myself far outside my usual boundaries, and it's enabled me to work with some inspirational teams, members of my fellowship team and also my CWPAMS team. You know, I've been able to work with Health Education England colleagues in my CWPAMS team and behaviour change colleagues, health psychologists, and also the amazing fellows that we've worked with. And Diane and Fleur, we've learnt such a lot from them. It's really developed my confidence and resilience and has motivated me at work, and most importantly has made me believe in myself. I've developed the powerful art of reflection, which I do incorporate into my daily life, and it's made me realise I'm not just a pharmacist. I am a pharmacist, and I am proud to be a pharmacist.
So what has the fellowship meant to me? I'm an infectious diseases pharmacist, and I have been a pharmacist in the NHS for 15 years. And this is the first real opportunity I've had to use my pharmacy skills in another country. I also hold some of the fellows responsible for me currently undertaking a master's in infectious diseases at the London School of Hygiene and Tropical Medicine. I was at very much a crossroads in whether I should do this or not. And when I went to the first fellowship event, Diane and Edwin in particular encouraged me to continue with my studies. The fellowship as a whole and as part of the CWPAMS project has given me a real chance to feel that I've made a difference. It's definitely improved my leadership skills and hugely improved my job satisfaction. It's also been a key chance to be part of a group with similar interests. But personally, I was going through a bit of a change. So I have a 2-year-old daughter and I didn't know if I should do this. But it's made me realise that it's okay to be a mother and also to be ambitious with my career. And I just want to say that it's been the best year of my professional life. It's been an honour and a privilege to take part in such a project and a fellowship. And without the support of key people, I wouldn't be here today.
Cool. So when asked what does the fellowship mean to me, I have to honestly say there was time that I feel overwhelmed, want to cry, but did not cry. And what have I done to myself? But what I've gained in return have outweighed that. As a pharmacist with less than 5 years of experience, the opportunity to work on a global health project is invaluable. Even though as a Malaysian, I have experienced a healthcare system in another country as a patient, but seeing the healthcare system in Uganda as a healthcare professional has opened my eyes. I was amazed by what has been achieved with their enthusiasms, even though there are limited resources. And through the fellowships, I have the opportunity to receive leadership training, which I've never exposed to before. And one thing I learned is the power of mentorships. There was a saying that mentorships is not about being the authority, but it's about elevating others, which is exactly what I've got. One last thing I want to say is, if I could do it all over again, I would do it without a second thought.
So we were all tasked with providing a single slide to capture the impact of the last 18 months on ourselves, and this is mine. I'm not going to apologise for how busy this slide is, because I think it's a true reflection of how my synapses have literally been on fire and how my mind has just been open to so much growth and opportunity, and I've been inspired by so many people. As everyone said, it's been the steepest learning curve with lots of work, but it's given me a newfound enthusiasm for professional development and a passion for global health. In the beginning, I sort of put this into 4 categories, but actually the truth of it is that a lot of this overlaps. Buckinghamshire Healthcare Trust were welcomed into a 10-year strong health partnership between Nottingham Trent University and Makerere University. And it's through this healthy attitude of cooperation and not competition that we've learnt so much and had the privilege of witnessing true leadership in action. Our project was focused on a One Health approach, which required us to reach into the communities in Wikizo, Uganda, to provide sustainable solutions. And this has given us new confidence to reach into the communities of Buckinghamshire and the networks within the UK. The greatest changes for me have been on a very personal level. The positivity that I've experienced and the can-do attitude is infectious, and I've been very fortunate to meet so many people like this. One community health worker said simply, "When you love something, you do not see the challenges," and this has resonated with me and my feelings for the NHS. Diane herself has been truly inspirational and has encouraged all of us to say yes even when we're scared, and that's why we're sitting here now. Professionally, I've been pushed out of my comfort zone and beyond to do things I would never have dreamt of. It's been wonderful to hear about the successes of people working towards the same goal in sometimes very difficult situations, and it really makes you realise that we can all do just a little bit more.